So in our study, we wanted to see how non-invasive brain stimulation, and in particular transcranial direct current stimulation or TDCS, can be used in order to regulate aggressive behavior. What we did was use an anode, which is the positive electrode, and a cathode, which is the negative electrode, and we see how this can modulate two different areas of the brain. So we used a bihemispheric montage to regulate aggressive behavior in males and females. What we found is very interesting because we saw that males actually, we find an effect in males on aggressive behavior when we stimulate the right dorsolateral prefrontal cortex, or DLPFC, but we do not find this specific effect in female participants. This study is one of the first to demonstrate that there are sex differences regarding TDCS for the modulation and regulation of aggressive behavior. And by demonstrating that biological sex and personal dispositions jointly influence the outcomes of brain stimulation techniques, this study further advances the concept of tailored treatments, and it also has real-world clinical implications for conditions that are linked to aggressive behavior or, more in general, impulse discontrol, such as borderline personality disorder, antisocial behavior, and substance use disorders as well. And this goes in the same line for future perspectives in precision psychiatry and gender-specific medicine. We think this work is fundamental in order to get closer to have more specific and tailored treatments for different psychiatric populations using brain stimulation techniques such as TDCS in our case, but also transcranial magnetic stimulation or TMS, and have personalized intervention for each individual participant. So in order to see the real effects of TDCS, that's what we need to do. So to get closer to more individualized and tailored treatments for specific psychiatric disorders and for specific conditions. We think it's very important to integrate brain stimulation techniques with neuroimaging techniques as well, such as functional magnetic resonance imaging or fMRI. And that is something that we're actually planning to do, and we're currently doing here within the TRR379, which is a project that has been recently founded at the Uniclinic. So we're interested in seeing which area activates during TDCS in order to be even more specific and create even more tailored treatments.